So hello everyone, welcome to the Zoom meeting. We're going to work on different topics today. So I will leave to Rawia, please. Go ahead.
Okay, hello everyone. Today our green team will present 4 topics. We're gonna start with chronic care management with Dr. Maya. So Maya, if you are ready.
Yes, Dr. Rawia, I'm ready. Yes, let me share my screen. Yes.
Okay.
Everyone able to see my screen?
Yes.
Okay, thank you. Yes. Hello, Dr. Nader. Hello, everyone. Yes, today I'm going to present chronic care management topic. This topic is actually very huge, but like I'm trying to concise because I'm going to present in a journal way. Otherwise, this topic is related with every system like chronic care of cardiac disease, chronic care of liver disease, chronic care of kidney disease. So this is a huge topic. Today I will cover like a more journal view, how we are dealing with patients day to day in the hospital and how we are managing chronic diseases in our best expertise. So chronic care management premise right things. Like what right things? When we are like seeing a patient who is suffering from one of the chronic disease, any kind of chronic disease, we have to like perform any labs, any imaging, any we are giving any medication to patient. Everything must be patient-centered and patient-based interest, because we don't want to put any extra burden on a patient, because patient is already in a chronic disease, so he's already with a huge burden. We try to lessen his or her burden while giving them a right treatment, and we do every much which is in best interest of patient. So these are the right thing and the right patient. Right patient means if we are deciding to do something for the patient, for example, I'm giving just an example. If patient is coming to us with a persistent bacteremia, and one patient and other patient simple have fever of unknown origin. So yes, we in the starting we maybe start some antibiotics with broad spectrum, but we try to narrow down our differential, because like if we giving them continuously antibiotics by to reduce their infection is not going to work. First, we narrow down the diagnosis, and after getting cultures and lab result, we also narrow down the antibiotics, because in that way we maybe give them a best care to right patient. And what a right time? Right time means sometime we are not very aware of disease. We don't know the diagnosis, how the diagnosis is like. We have different diagnoses in our mind, but we don't feel shame anytime. We have a whole disciplinary team. When we are seeing patient, we have attending physician, we have resident physician, and even though pharmaceutical agent is always involved in a team. So if we don't know any right treatment for the patient, we can like discuss the case with anybody, because this is a team. Seeing patient, monitoring patient, and treating patient is a teamwork. So at the right time, we can right time is the best time. We discuss the diagnosis with multidisciplinary team, and then we come across with right time and right treatment. Then I want to discuss how the chronic care management model works. So basically, there's a community from the community, we have different resources and policies. And second is a health system. So in healthcare organizations, we have different logistics to deal with, like self-management support, delivery system design support, and clinical information system. These are the two main factors. Then we must inform activated patient. Like we have to give each and every information to patient, for everything from admission to patient is going to discharge from our service. We have to inform them everything very well, so patient can take the right decision for his or her health. So then we have a prepared proactive practice team. We involve whole team, and whole team, even though if it is a chronic disease or any minor disease, we have whole team like physician, nurse practitioner, we have a case manager, we have pharmaceutical agents. So we are working as a team. So whole team must be well informed about how we are dealing any patients. And this if we combine these all factors, this is a very productive interactions. And what gonna happen by this improved our outcome. And we want a best outcome for each patient, because as a doctor, we are we have aim to give right care to the right patient. Then how we mobilize the community resources, like patient participate in effective community program. We give them awareness how they active themselves, and form partnership to fill the gap in needed services and avoid duplicating efforts, advocate for policy to improve the patient care. So we do basically everything patient-centered. Then I want to discuss health system organization of care. Improvement at all levels of the organization promotes effective strategies, open and systemic handling of errors and quality issue to improve care, provide incentive based on the quality of care, then facilitate the care coordination within and across the organization. Then self-management support, patient has the central role in managing health. Self-management support strategies like assessment, goal setting, action planning, problem solving, and follow-up. These are, and on top of it, we also use community resources to support, to encourage for the self-management. Then how this delivery system design works, it define roles and distributive tasks, planned interactions for evidence-based care. We have to plan everything, what's our diagnosis, what's up-to-date medication for the patients, what's up-to-date lab investigation, everything we have to do patient-based interest. And then clinical case management services for complex patients, and a regular provider initiated follow-up, culture sensitive care. These all factors we keep in mind when we are dealing with any chronic disease. And then decision support, daily practice of evidence-based care, and they share clinical guidelines and information with patients. Even though some patients already Googled about their diagnosis, nowadays patients are more aware and well informed about their disease, about what are the treatment they are getting, and they are much aware. But instead of that, we try to give them all information they needed for their health, and they provide professional education. We when we are discussing the case with patient or any medication with the patient, we have to keep in mind, we give them all the options, then they take the decision about their care. Then integrate the specialty and primary care. This is also very important. Sometimes we treat them and we discharge them from the hospital. But sometimes we don't mention they have to regular follow up with their primary care. They have to continue monitor their care via primary care. They don't need every time. They don't need to come to the emergency department or to the hospital. We teach them, we educate them. They usually follow up with the primary care so they can monitor their health properly. Then clinical information system, like timely reminder for provider and patient. This is very important. We email them, we keep a track how patient they are aware, they have the appointments, they have follow-up visits. So via this we can improve. And then identify subpopulation for proactive care. Facilitate individual patient care planning and share information, monitor outcomes. We don't have, as a doctor, we don't have a goal to just treat them and send them home. No, we have to continuously monitor them and see. We always keep in mind, we see the outcomes, like after giving them best medication, what are the outcome happens with that patient. So we always keep track of them. So registry tracks individual and population via any software electronic medical records, and we just follow them very properly. Then chronic management programs, chronic care management programs. These are the comprehensive system change, targeting, and case management. This is also combination of multiple factors, we always see a case manager also involved in any chronic care, if patient is affordable or not, and how they are managing their resources or everything. So we must include this one too. Then primary care delivery system traditionally provide the acute care. Then we have to go for the diagnostic and laboratory services, treatment of design, signs and symptoms, prescription, brief education, short appointments, and patient initial follow-up. That's very important. Then targeting approach, correctly assume a small % of population outcome for most healthcare cost. We already know that here disease burden is very high. So especially cardiac disease cost a lot when we do different tests, we take them to the cath lab, we do all procedure. So cost is very high. So we properly educate them so they can take care of themselves to reduce burden via regular follow-up. This is the best way. Then possible to reduce the cost based on this method. This is also very important. When we are choosing any treatment, we must see the cost of the treatment, not just say we are treating to the patient, so we give them any kind of antibiotic. No, we have to see what are the costs. If we in that comparison, in that antibiotic comparison, if we have low cost antibiotics, which is working in the same way, treating the patient same problem, so we choose this to reduce their burden. Then however, health status changes occur frequently. Yes, because sometimes patient comes to us, they looks very healthy, but they have some chronic disease, but they take care of themselves, so they look very healthy. They don't look like they are sick, but we evaluate them thoroughly, so we can find out what's going on with them. And targeting, this is a substantial portion of the population at risk. Okay, so we can see if a patient has diabetes, so we have already, we educate them, you have to take care of their feet. Sometimes they develop microvascular and macrovascular complication. So we educate them in a very well way, so they don't develop the complication from those diseases and they get into trouble. Then case management approach. Many programs include brief hospitalization, low intensity follow-up care, and conduct utilization review. This is like also, these are also factors. Then I have like this data from different countries. So this is basically how many primary care physicians are using medical electronic medical records. So I found out in this, like there's just a 17% in America. So different country have different percentage of using electronic medical records, but here is, I found out this is 17%. Then chronic care management overreaching goals, like how we improve the health status. How we improve the health status by regular visit with health provider, focus on function, prevent exacerbation and complication, emphasize self-management, ensure access to the services, proven to improve the outcome, and then establish a link through time with information system. And most important, follow-up initiated by medical provider. In summary, chronic care management offers improved health status for many with chronic diseases. Chronic illnesses care should be based on the best available evidence. And last but not least, need consistent quality measures and additional research in the various models. So we have to keep in mind what we are before using for this chronic disease, now up to date, what medications are available. And we also, of course, see the patient affordability, but we do was like patient-centered interest. Yes, this is all about my presentation. Thank you so much for listening.
Thank you so much. This is great presentation and very short and concise to the point. Thank you so much for covering this topic.
Thank you so much, Dr.
I really appreciate it. So any questions, please raise your hand or jump in. So nowadays, as doctors, we are involved in multiple things beside the medical field itself, like the patient relation with the provider. This is one part that you will face, you will see, and there are other parts that you will be involved in. The simplest way I can put it as example, you will be in an academic institution, you will be asked to teach medical students or residents or fellows as you go along. Or another part is doing some research. So it's putting some hats along these lines. Now, with this topic, you work with others to achieve some goals, not only for one patient, but more than one. And in the future, we will talk about population health, also telemonitoring. So patients you will see at the hospital, you want to follow, or the primary care physician will follow remotely. Cardiologist will follow their heart condition or heart failure patients remotely and try to avoid hospitalization. And the goal is to minimize the cost of healthcare system here. But thank you so much for this important topic. Any questions? If not, we can.
Thank you, Maya, for the informative presentation. And moving on to our next presentation, it will be effect of digital reminiscence intervention for people with dementia, and will be presented by Dr. Osama. Dr. Osama?
Hello, yeah, I'm here.
Yeah, hello.
Second. Hello, everybody. Good afternoon. Today we have a really interesting topic about the online life storybook. It's a randomized controlled trial on the effect of a digital reminiscence intervention for people with very mild dementia and their informal caregivers. Introduction. At present, the number of people living with dementia worldwide is estimated at 47.5 million. This number will increase to 75.6 million in the coming 15 years. Dementia is among the top 5 with the highest burden of disease for persons over 65 years. And it belongs to diseases with the highest burden for informal caregivers. This burden includes physical, emotional, and economic pressure. Dementia is often accompanied by the presence of neuropsychiatric symptoms like apathy, agitation, depression, anxiety, and delusions. Neuropsychiatric symptoms not only affect the quality of life of the patient, but also result in a higher burden for informal caregivers and a lower quality of their lives. Reminiscence, which involve the active retrieval of personal memories, is a person-centered behavior approach. Personal memories are shaped by the autobiographical memory system, which remain intact for a relatively long time. The online life storybook has a different approach than most existing applications, as it focuses on the unique life story rather than on a specific complaint and symptoms. The online life storybook builds on research on reminiscence. Research has shown that remembering and reliving precious personal memories can create feelings of pleasure, familiarity, and assurance. So most persons with early dementia are able to retrieve personal memories and share them. And even in later phases of the disease, they can still relive the positive feelings associated with precious memories. When the disease progresses to and memory further deteriorates, it becomes more and more important to offer multisensory cues for memories in a structured way that fits the unique life story of the person with dementia. So the design of the research, it was a 2-arm randomized control trial with individual randomization and 3 measurements at baseline. So like there was like 3 measurements at baseline, and there was a measurement at 3 months and 6 months after baseline was conducted. The description of the intervention, the online life storybook, is an e-health application that allows placing personal memories on a dynamic timeline. The timeline is easily marked with historical years, memories like life events, anecdotes, photos, movies, voice fragments, and music, and recipes, preferences, and activities can be placed on the timeline. To make the application safe and warrant privacy, all information is stored on a secured server. Trained volunteers supported the people with dementia and their caregivers in the following, referred to as dyad, in making the OLSB. This is more cost-effective for care institutes and easier to organize compared to interventions delivered by a volunteer instead of a care professional. It can be less stigmatizing, as volunteers provide contact with society rather than with healthcare professionals. The volunteers visited the dyads approximately 5 times within a period of 8 to 10 weeks. The volunteers followed communications guidelines with regard to dementia and reminiscence. They asked dyads about specific milestones and important memories and nudged them to tell about it as explicit as possible. The volunteers tried to get a variety of memories from different phases of life. Persons with dementia and their family members collected materials that the volunteer digitized when necessary and uploaded in the OLSB. So the primary outcome was there was no significant effect of time, condition, or their interaction. The significant difference in gender of the person with dementia between the 2 conditions at baseline did not affect this outcome. So there was no significant effect of time, condition, or their interaction were found. except for the gender of the person with dementia. There was no significant difference between the intervention and control condition on any of the demographic and health variables of the persons with dementia and their caregivers. There were also no significant differences in the total baseline score and the four domain baseline score of neuropsychiatric symptoms between the intervention and the control condition. And lastly, there was no significant difference in any of the measures of distress or quality of life of the caregivers at baseline. Again, there was no significant effect on time or condition or like any interaction. So the conclusion is, despite the absence of significant effect on the use of an online life storybook for people with very mild dementia and their informal caregivers, this study contributes to the research on life storybooks and does provide valuable implications. It shows that in future research, it is important to study the effects in persons with more complaints and higher burden, and to be careful in the selection of outcome variables in relation to the to the reminiscence functions served by the intervention. So why did we get these results? There was like several factors. Number one, there was like the people with dementia reached in our study appear to have few neuropsychiatric symptoms, whereas caregivers did not perceive much distress and reported a relatively high quality of life compared to other studies with the same target group. And number two, outcomes might not have been significant because less people participated than initially anticipated. And number three, the people that withdrew did so mostly because of reasons that were not related to the intervention itself. Thank you.
Thank you so much again. This great presentation, excellent work.
Thanks, Dr. Nad. Thank you, everyone. Thank you for listening.
So it's a new way of approaching things. So using technology. So in the past they used life story like books. So you ask the family or the members close to the patient with dementia and see if they have some memories that's significant, gives them enjoy, they talk about it. And so whenever they have stress, agitation, or some behaviors, the family or caregiver can refer the patient or trigger the memory of that pleasant event in the past. Like if they have some good memories about certain things, then they will talk about this. Or if they have a photo of a person, they will bring that photo, something like that. So it will help with some of the behavior, neuropsychiatric behavior. Thank you. This is great presentation. For this study, they did not find significance, and they raised the point of what are the reasons might be because of that. So there are some withdrawal, and maybe the participants are not with the high burden as in other previous studies. Thank you.
Thank you, everyone, for listening.
Thank you, Dr. Osama, for the interesting presentation. Moving on to our third topic, it will be use of technology for reminiscence therapy, and will be presented by Dr. Sulafa.
Hello, everyone.
Hello, Sulafa.
All right. Yes, I'm going to share my screen.
Okay, go ahead.
Can you see my screen?
Not yet.
Okay. Just I'm sorry, just a moment.
It's okay. Take your time.
Can you see it now?
Yes.
Yes.
Just a minute. I'm sorry for that. So I'm going to present a systemic review of the use of technology for reminiscence therapy. So as overview, dementia is the most prevalent symptom of the symptom of dementia is mostly memory loss, but it can also impair our cognitive abilities, include language, judgmental, and problem solving, as well as the capacity to perform everyday activity on one's own. So, but we usually understand dementia as memory loss, but it can impair other aspects like the cognitive function and the problem solving and the judgment. There is need for non-pharmacological treatment to meet the social and emotional requirements of people with dementia, even as pharmaceutical treatment to address the biological aspect of the disease have advanced. So NICE clinical guidelines recommend using non-pharmacological therapy for problematic behavior in dementia before turning to pharmaceutical one. So as we know, usually we provider and clinician like to start with non-pharmacological intervention before they intervene with pharmacological one, as we know, like the side effect and the interaction with other medicines that elderly can take. So the number of persons with dementia rises proportionally as the population's age group expands. People above 65-year-olds now are expanding. So proportionally, dementia cases now are more. The incidence of dementia may be the same, but the prevalence is expanding. And this underscores the need for therapy that address the social and emotional requirement of those with dementia. So according to estimate, 14.7% of Americans over the age of 70 suffer from dementia in 2010. So this paper, and I will share the paper with you later in the chat, talk about the information and communication technology, ICT, and they talk about potential platform for assisting the delivery of these therapies, such as Reminiscence therapy, which is called RT, non-pharmacological interventions that involve evoking memories of the past, frequently with the aid of artifacts like olfacto, music, for therapeutic purposes like the facilitation of social interaction or the elevation of self-esteem. So all of us, when we see a photo or a picture of something, we might recall certain memory or certain days. So like they use this technology to improve the memory for people with dementia. And the paper and the purpose of Amanda Lazar's paper is to assess the current state of the evidence and identify future development by methodological review of the scientific literature on the use of ICT for aiding RT. So here, like overview of therapy we are using for dementic patient. There is behavior therapy, validation therapy, and reminiscence therapy. The behavior therapy address trigger of challenging behavior. The validation emphasizing with expression emotion. And the RT employing artifact to elicit memories and spark dialogue for the benefit of the present. And one of the advantages of RT compared to other therapy mentioned above is that it can be used with people with varying level of cognition, including those who have lost the ability to verbalize. So RT has potential to improve staff care as well as the lives of those who care for those dementia, like the caregiver for dementic patient. So reducing social isolation, giving engaging and exciting activity, increasing self-worth, and providing methods to maintain ties with loved ones are some of the therapeutic goals of RT for people with dementia. So although recollection frequently includes enjoyable experience to foster enjoyment, it can also include painful or upsetting memories for the therapeutic or cathartic purpose. For example, if we show the patient with dementia a picture, he can recall or she can recall enjoyable experience. But on the other hand, also this memory could be like very sad or painful or upsetting memory. So the method for this article, there is 3 databases were searched. The first one, ACM Guide to Computing Literature, PubMed, and PsychoInfo. And this the date listed for which article they are using. So about inclusion and exclusion criteria, the author of the article, what like paper they included and what paper excluded from their research. To be included in the study had to be written in English. This is the first thing. Detail the design or evaluation of RT intervention, employ ICT in the delivery of intervention, and aim at dementic patients. So like this kind of therapy can be used for many reasons, but the paper that they are collecting and do the systemic review should be focused on patient or people with dementia. This is our sample. Abstract, theoretical, conceptual paper, books, and review were excluded, as well as introduction and letters comments. So 100 finished papers were evaluated. There is 44 papers and 24 ACM paper, 13 PubMed paper, and 7 PsychInfo article met the inclusion and exclusion criteria, and they use it like a resource for this study. And many of the study were case report indicating the field's early stage of research. So we know that there is like hierarchy for the value of the paper and study, and case reports are not of the best one. Like we know the randomized control trial and cohort are better than case report. So in this research, many of the study were case report. Results could not be meta-analyzed because of heterogeneity of the study. So as we know, if we want to pull all the p-value and we want the p-power, homogeneity should be there, but these papers are not meta-analyzed because the heterogeneity of the study. So there is something called Reminiscence kit, which is portable collection of non-technological trigger, like, for example, old toys, fragmency, maps, and food, as well as technical trigger like slides, records, was mentioned in some of the study. In this review, some research utilized commercially accessible kits. So the result of the study: usability, acceptability, interaction between dementia patient and caregivers or employees, focus and distraction while using the system were only a few of varied outcomes. So among those studies, there is few studies examine health outcomes, such as how they affected the mood and cognition, provided a thorough assessment of well-being or participation, indicating the early stage of the study. So as general, the level of stimulation desired, it's a factor to be considered while developing multimedia memory items. That's why researchers appear to adhere to the maxim, which is called the more, the better in general. One group, for instance, incorporated images, background music, narration, panning, and zooming into its memory video presentation. So they will do video presentation to help people to recall the old days memory, and they will start with background music, narration, panning, and zooming for this video. So in conclusion, this study is constrained in several ways, like there is limitation. Paper may have been published in additional databases that were not considered in this review. However, 3 extensive databases with majority or of non-overlapping content were used first. Also, there is publication bias. Many papers that are published may only be ones that describe good results. So also, for example, if we want to replicate their study, we should collect the many papers and research similar way that they have been collected, and start to do the meta-analysis with the same type, and it could be also heterogeneous, so we can replicate their results. So this is the reference that, or this is actually the article that I'm reviewing these slides, and I will share it in the chat later. So feel free, please, to unmute yourself if you have any question. And thank you so much for your time. Yeah.
Thank you so much. Awesome presentation. Thank you.
Thank you. Thank you, Abdelsamad. Okay.
So
Thank you.
again, they use some of the technology to assess or to help patients with dementia. So I'm interested in technologies. That's why I want you guys to think not only for clinical patient care and disease oriented, but also use other tools or things that are available. So technology, if you think about any idea, if you include technology, there is a chance that you can publish with that. So like COVID nowadays, if you are interested in doing any research, if you include COVID patients, you have a higher chance of getting something published. Thank you.
Thank you so much.
Thank you, Sulafa, for the great presentation. Moving on to the 4th topic, it will be leadership skills, and I will be presenting that. So I'm gonna share my screen. Leadership skills. Before we talk about leadership skills, we need to know a little bit about leadership. So let us start with what is not leadership. or what is not related to leadership. We have seniority, titles, personal attributes, and management. Seniority has nothing to do with leadership. Leadership does not occur automatically when someone reaches a certain pay grade or seniority level. Titles, with seniority, just because someone attains a high title level does not automatically make them a leader. In fact, a person can be a leader without a title in their place of worship, community, or family. Personal attributes. Most people associate the term leader with a commanding, charismatic figure. However, leadership is not an adjective. We do not require extroverted, charismatic trait to practice leadership, and charismatic people do not always lead. For management, leadership and management are not the same thing. Managers must plan, measure, monitor, coordinate, solve, hire, and fire, among many other tasks. And managers typically manage things, but leaders lead people. So we come to the question, what is leadership? There is no an easy answer to this question because there are many types of leadership. But we can use this definition. Leadership is the art of motivating people in an organization or workplace to work to achieve a common goal. It is based on individuals' own ideas or ideas inspired by other leaders. Leadership can also be defined as the art of effectively communicating these ideas to others and encouraging them to take on responsibilities and grow personally while also leading the organization to growth. Overall, leadership is not only inspiring to oneself, but also to others. So these are 8 common leadership skills, including relationship development, adaptability and agility, creativity and innovation, employee motivation, decision-making, conflict resolution, negotiation, and critical thinking. Relationship development. A leader who have strong, trusting, and authentic relationship with their teams understand that investing time in developing these bonds make them more effective leader and set the stage for success. Good working relationship boost employee engagement, and according to Gallup employee engagement meta-analysis, business units with high employee engagement have 41% fewer quality defects and 37% lower absenteeism. Higher employee engagement also resulted in 21% increase in productivity. So even if you believe you do not need to be loved at work, being an effective leader will require you to be skilled at building good relationships. If your team is highly engaged and happy at work, you are likely to be well respected as a leader with employees who love what they do, and the strong relationships you encourage will hopefully help your team perform at their highest level. Adaptability and agility. The Development Dimension International conducted studies in 2008 and 2022, and they conclude that facilitating change and adaptability are 2 of the most important leadership qualities. The hyper-competitive business environment, geopolitics, climate change, the change brought about by the COVID-19 pandemic, and many other factors all require leaders adapting and developing agility. Effective leaders must be able to adapt to internal and external change, even if it means working outside of their comfort zone. As a leader, you must create lifelong learning mindset to ensure that you are not left behind by any change and can give your workplace a competitive advantage. One important way to develop leadership agility and adaptability is to be accountable and assume your responsibilities while also ensuring that you have a plan in place for how you will respond to change. This plan should include an achievable timeline that allows you to constantly assess how well you are adapting to the change and represent this to your team. Next, we have creativity and innovation. Leadership innovation is critical for every organization. Ideation is the process by which outstanding ideas are developed and become the foundation of innovation success. Looking at industry leaders such as Apple, they become leaders in the technology industry by making product innovations with their customers in mind and by continuously forging ahead of the competition. The growing demand for creativity and innovation will continue to be a driving force for leaders who will need to refine their leadership skills in this area to be effective and competitive. Employee or followers motivation. Knowing how to continuously motivate employees is one of the most effective leadership skills, which requires a leader to be connected to their team and aware of what is going on around them. Motivated employees are not only more engaged, but also more self-confident in what they do and can do. This teaches them how to react in difficult situations and generate innovative ideas that can help improve their team performance. Employees who are not motivated can have a negative impact on their organization or workplace due to absenteeism, exhaustion, and low productivity. Decision-making. A leader is constantly tasked with making decisions. To be an effective leader, those decision-making abilities must be exceptional. Critical decisions that have a large impact on your organization must be sound, rational, and solid. Your decisions as a leader will determine your and potentially the success of your organization. Making decisions, no matter how big or small, is an essential part of leadership. As a leader, you must develop strong decision-making skills and the conviction to stand by your decisions, while also recognizing the need to adapt when those decisions do not result in the desired outcome. Some decisions may not always be favorable. Making an unpopular but necessary decision is one of the most difficult tasks a leader faces, but it is critical that leaders recognize their responsibilities and make clear decisions for their team or organization. Conflict resolution. A conflict is defined as any disagreement between two or more people that has the potential to disrupt work. When conflict arises, an effective leader should be able to intervene and resolve or at least mitigate the conflict before it has a negative impact on the team. When handled properly, conflict can be beneficial to your team as it can often lead to stronger bonds or new ideas. An effective leader must be skilled at identifying conflict and planning how to resolve it. When confronted with a conflict, it is also critical to remain rational. Conflict resolution is without doubt one of the most important leadership competencies. As a leader, you must be able to manage conflict, but developing these skills in your team can help you avoid conflict entirely. Negotiation. Negotiation is the process in which two parties with opposing viewpoints came together and come to agreement on an outcome. The process of negotiation involves 6 stages that are preparation, discussion, clarification of goals, negotiation towards a win-win outcome, agreement, and implementation of the course of action. Good negotiations can benefit an organization by strengthening relationships both internally and externally. Negotiation is used by leaders to understand the interests of their employees or teams and to define ways to satisfy those interests to achieve organizational goals. Critical thinking. It is the ability to think clearly while connecting differing ideas logically. Critical thinkers are frequently intelligent decision makers who are highly analytical and always rational. Critical thinking is a learned skill that generally consists of 3 steps: frame, explore, and decide. Critical thinkers typically question ideas and assumptions rigorously. They always seek to determine whether the ideas, arguments, and findings represent the true picture, and they are frequently able to recognize inconsistencies and errors in reasoning to achieve the desired outcome. So those were some of the leadership skills. Now we are moving to leadership styles. We have democratic, autocratic, laissez-faire, strategic, transformational, transactional, coach style, and bureaucratic. In democratic leadership, leaders make or break decisions democratically based on the opinions and feedback of their team. Although the leader makes the final decision, every voice is heard. Because it gives employee a voice, this is one of the most effective leadership styles. The autocratic is opposite of democratic leadership, in which employees' opinions are ignored. Leaders with this personality expect others to follow their decisions, which is not a long-term strategy. Laissez-faire means let them do. The leader who uses it ensures that employees have authority. While this leadership style can empower, it can also limit development, so it must be used with caution. Strategic leadership serves as a link between the senior team and the employees. The transformational type of leadership is always looking to transform and improve function and capabilities. And most companies that are looking to expand use this type of leadership style. The transactional type is very common leadership style today. It is based on the action and reward concept. The coach style leadership type focus on larger growth while encouraging individual team members to focus on their strengths and talents. Though this is like strategic and democratic leadership styles, the focus here is on the individual. The bureaucratic type follow the rules. Although leaders who take this approach listen to employees and their opinions, they may reject or refuse these opinions if they contradict the company policy. So what are some of the qualities good leaders should have? Share their vision. Leaders should have a clear vision of where they want to go, how they aim to get there, and what success looks like. Also, they should work hard to achieve that vision, to inspire and encourage others to do the same. Second quality is honesty. Honesty is the foundation of any relationship, personal or professional. People want to work for a leader in whom they have faith, morals, values, and integrity. We have also the leader had to communicate effectively. The ability to communicate clearly and concisely is an important leadership skill. Communication includes more than just paying attention to others and responding appropriately. It includes sharing valuable information, asking intelligent questions, asking for input and new ideas, clarifying misunderstandings, and being clear about what you want. The most effective leaders communicate with their team to inspire and energize them. Also, a good leader should be confident. It is the responsibility of the leader to keep the team motivated and moving forward. The team will not be concerned if their leader remains calm and confident, as they have placed their trust in them. Although it's not required, but a sense of humor contribute to a positive work environment and encourage the team to feel comfortable around their leader. Moving on the qualities of good leaders, the amount of passion the leader has directly affects their attitude, energy, and that of their followers as well. Also, integrity. Strong moral values are important leadership characteristics because they allow others to clearly define with you. Courage. Leadership sometimes requires making unpopular decisions, which need a certain amount of bravery. A courageous leader must be willing to try new things, have greater trust and confidence in others, and be able to raise difficult issues that others would leave unresolved. Discipline. Leadership requires self-control, inner calm, and outward resolve. Also, the high level of determination and willpower contribute significantly to the leader's ability to be self-disciplined. Inspire others. The most difficult task for a leader is convincing others to follow. It is only possible if you set a good example for followers. When things get tough, They look up at you and watch how you handle the situation. They will follow you if you handle it correctly. As a leader, you should think positively, and your actions should reflect that positivity. Stay calm under pressure and keep the motivation level up. Empathy is another quality for a good leader. It is the ability to understand and share another person's feeling. This is extremely important in any workplace and helps in the management of conflict and relationships. Empowerment. It's a good leader should be able to train and develop the team so that it will be fully prepared for any challenge the team can face. Team building a strong team that work hard and work well is another trait for great leaders. So what should we do to be good leaders? Learning how to be good leader can have a significant impact on the success of your team, organization, and yourself. You must understand your own motivations, strengths, and weakness in order to be an effective leader. Great leaders build relationship with their teams by encouraging open communication, encouraging employee growth and development, and providing and receiving feedbacks. So that's it for me. If anyone has any comment, addition, or question, go ahead.
Thank you so much, Dr. Rawia. This is excellent, awesome presentation as well, and to the point. And I think all of us needs to focus on some of these qualities and work on getting some of the skills that are needed as we go along. Hopefully soon you'll be residents and in the medical field, or for the dentist, you will also be in your training. So at one point you will be a junior, at another point you will be the senior. When you will be the senior, you will have your own team, so you will need to lead them, what they need to do, divide the task, and set the goals. As you get further along the road, you will be in other teams. Either you will join organization, if you want to do your own business, also you will have your own team in the clinic, so you will need to acquire the skills of leading individuals. So thank you so much, I really appreciate it.
Thank you, Dr. Nader. Thank you.
Yeah, there is a leadership course here at MSU. I took, it's a class of 4-week class. It's about $1,000 or $1,100, but they discuss some of the topics. They practice these topics, and they come from different backgrounds, different countries. It's online, so you will see how they do things, and they can also share some examples. For example, some of the companies raised when the internet started. One of them is Google, one of them is Yahoo. Other companies that provided, for example, services like free emails, but for some reason they did not survive. So the reason for not survival most likely because of the leadership, what their goals, how they manage their employees, what adjustment they needed to do that they didn't do, or things like that. So we focus on certain examples and see what went right, what went wrong, so we can learn from this. It's kind of interesting. But in the medical field, you will be at one point a leader. So start from now, obtain some skills in this area. Thank you. Any questions, any comments? If no, then we can talk about the ideas or topics about the projects. Any updates about the projects? I know Mafaz sent me the poster. Congratulations for the acceptance. She and her team sent an abstract to
المسؤول من اللي ذاته دايركتور.
Ragda, you want to join? So thank you so much. I sent Dr. Mfaz a poster. Hopefully they will participate with the conference and see, share their experience there.
Yes, Bernardo, thank you. I got the email for the poster and edited it. Yeah, I'm glad that it was accepted. We'll be presenting it on 23rd to 24th February, inshallah.
Inshallah, around the corner. That's good. Congratulations.
Thank you.
Are you going in person or it's virtual?
It will be a virtual presentation.
If you can access some of the recording, that would be great.
Yes. Okay, I'll make sure to record it, inshallah. Yes.
Okay.
Thank you.
And I know AMDA also has accepted some of the abstracts for their coming meeting, and we are working on getting the posters. So congratulations to all teams that are involved. Any other updates as far as what's going on with your projects?
Hi, Dr. Nader. This is Ragda. Sorry about earlier. So yes, we started to write the manuscript for our project, methylene blue and treatment of Alzheimer's disease. Actually, we finished. We just need to review it and proofread it and everything else. Thank you.
Sounds good. Great. Excellent. So let me know how can I help any. Thank you. Anybody else?
Hi, Dr. Nadir, how are you?
Good, thank you.
Yes, so I'll be sending you the PDF for the poster for to edit it, and for the first one, and the second one will be expected in 2 days, because I think we need to submit it by February 15th, the PDF as well as the recording.
Excellent. That's good. Thank you so much.
You're welcome. Thank you, too.
Anyone else? If no, then we can discuss any new ideas. Anyone wants to start a project or some projects, any ideas that you want to share? If you think about anything, shoot me an email. We can create a team and then we can work from there. I have some ideas and I'll be contacting some of you, see how we can start some of the projects in the coming days. So if nothing, then we will see you next week. Thank you so much, everyone. I'd like to thank all the presenters for great presentations, excellent work. Thank you so much, everyone, for attending. Thank you, Rawia, for moderating this Zoom meeting, and we will see you next week.
Thank you. Thank you.
Thank you so much. Have a great one.
Thank you, Dr. Nadir.
Thank you,
Dr. Nadir.
Thank you so much, Dr. Nadir. Have a great week.
Thank you, everyone.
Thank you, everyone. Thank you, Dr. Nadir.
Thank you, Dr. Nader. Thank you, everyone. Thank you, Dr. Nader. Have a great weekend.
Thank you so much. Dr. Amal, any news about your app or any other team members for new apps?
Hello, Dr. Nader. How are you?
Good, thanks.
So for me, I reviewed both the MIT App Inventor and Podular. So I did the first screen in each program, and I like Podular more because the design of the application looks much better than App Inventor. So in general, the design part of the application was easy and straightforward, but sticking the blocks together to create a functioning application was very challenging, especially when it comes to creating the sign in and sign up buttons and keeping the data private to each user. So I had to deal with databases, which is a complicated topic, to save users' data, and this was complicated. So I'm trying my best. I'm still trying to keep data user specific and do that sign up and sign in screen, because I think my application contains a private users data that should be contain the sign in and sign up system. So I'm not sure if it's clear or not.
Yeah, it's clear, but I think there is a way, if you play around, there is a way for each user when they download it, it's not going to be connected to a central database. It's not like Gmail or Yahoo. You have your Gmail, you can access it from anywhere. I think the idea is to download it into your mobile phone, for example, and then you can send the data that you enter, which will be saved in your phone, to send it to maybe the provider, healthcare provider, or share it with other family member using the email feature or sending as a text. So I don't think you need really to worry about signing at this time, I think.
So maybe I will try, but based on the search I did in Google, they said that any application that contains like sensitive data, like patient information, should contain this. The data should be stored in a database, but I'm not sure about that.
Yeah, I agree with you. So there is a way of using, or if you can find some, because login is a concept that's used by many. It's a lot of apps using that, this feature. So you will find some already made or easy to adopt ways of using it's not a difficult thing. So good job.
Thank you so much. I'll try my hard to make the app eventually and upload it to the Google Play.
Excellent, excellent. And your team is working with you, or are you solo? Are you working alone?
For the first part, I'm working alone just to try to understand everything, and then I'm going to engage my team.
Excellent. Sounds good.
Thank you so much.
Thank you.
You're welcome.
All right. See you, everyone. Assalamu alaikum.
Wa alaikum salam. Thank you.